Hi, I am David Katz. I'm the functional medicine pediatrician. I practiced functional medicine and pediatrics in Canton, Ohio for 32 years before moving to the Raleigh, North Carolina triangle, and I've been practicing here since then. As an osteopathic physician, I was taught to look at the body as one whole process and believe in the body's innate ability to heal. So that one of my nurses came to me excited one morning that she had attended a lecture over the weekend that the doctor espoused many of the same ideas that I had. And she said, "You sound just like him." Well, it was Dr. Mark Hyman, and I was complimented to believe that I indeed did sound like him. But she had bought me the tape of his presentation on functional medicine, and it truly intrigued me. And so it's something that I have dedicated my time and learning to become certified in functional medicine as a new way of looking at chronic medical problems. Because in our country, I wouldn't rather be anywhere else if I had an acute illness. There's no other place that can deal with it as well. But when it comes to chronic disease, our country is really not doing as well. That it is growing exponentially. It's increased from 16 to 19% of our gross domestic product over 3 years. And indeed, 6 out of 10 Americans have one chronic disease, and 4 out of 10 have 2 or more chronic diseases. So this means that we're not handling it well as physicians because we weren't taught to deal with chronic disease as we were with acute illnesses. But the scariest thought of all for me is that 1 in every 3 children born today will develop diabetes during their lifetime. And this is a preventable thing, as we will learn by how we deal with our life and our environment. And so we need to rethink how we deliver healthcare and how we process the information that we get from healthcare. Tremendous research has been going on, teaching us various ways to look at medicine and understand all the new aspects of knowing the human genome, looking at our environment, and various other things that make up what health is today. And so to do this in the traditional manner, this is how we were all taught in medical school, is that we were taught to have signs and symptoms and look and find a differential diagnosis, come up with a diagnosis code, which is the ICD-10 code so we could be paid, figure out the pathology of what was going on, and then arrive at a decision as to what we do with it, often medications or surgery to alleviate the symptoms. In functional medicine, however, we were really taught differently in terms that we take the same symptoms, but instead of coming up with a differential, we look and see what biologic systems are out of balance in their function and what could be the causes of that. And then we promote the balance and we get rid of what's irritating the system and we give back what the person needs to be as healthy as they can be. And so functional medicine looks at the underlying cause in a systems-oriented approach in a partnership with our patient. Generally, when people come to the doctor, they expect the doctor to give them something or do something that will relieve their discomfort. But in functional medicine, we're looking for the patient who comes to us and says, what can I do to aid in the situation? Taking some ownership in what's going on and how we can improve it. And so, for example, is depression a Prozac deficiency? This is one of the largest and fastest growing aspects of medicine today. And this is how often we're treating it. As somebody comes in, they have a diagnosis of depression, and we prescribe medicine to treat the depression. But as a functional medicine physician, we look at all the things that can cause depression rather than just treat the symptoms. And so we look at the food and the other substances coming into our body. We look and see what anti-inflammatory processes that we can bring in. And then again, what inflammatory or pro-inflammatory foods and substances we are putting in. We look for loneliness. We investigate as the patient on medications which can block the absorption of essential minerals and vitamins, which can lead to a depressed state. And 80% of us are either vitamin D insufficient or deficient, which is because we're protecting ourselves against sunburn and the sun, but we're not getting enough vitamin D converted from the sunlight in our skin. But much of the current and exciting research is going on with the trillions of organisms that make up our microbiome, particularly that of the intestines. And we used to think that we were just around to carry these guys around with us. But what we've learned is that we are in a symbiotic relationship with our intestinal bacteria. They provide nourishment for our intestines. They help to produce substances that we're unable to produce. And they, again, help us to protect our intestines. They also create an environment that helps to inhibit the growth of bad bacteria. And so they're protective of us in many ways. But when they become disruptive, we call that dysbiosis, where there's an improper balance. Then we learn that things go awry and that we're no longer getting that protection. We have one layer of cells from the mouth all the way to our bottom. And that one layer is meant to protect us against it. It is a semi-permeable membrane, and it, in hand with the bacteria, help to protect us against what is going on. If there's a break in that protective barrier, then things are getting absorbed that shouldn't be. They might be proteins that cause inflammation, or substances in our diet or on our food, or produced by the bacteria that causes irritation somewhere in our body. And so this is a very critical role that we play with them. In 2019, researchers at Duke identified neurons that go directly from our GI tract into our brain. And so even giving more credence to the concept of gut-brain reaction and interaction. And so the brain is being made aware of what the gut is sensing and knowing. And so in order to understand this better, we need to redefine what is a disease. In reality, a disease is a group of symptoms or conditions that we give a label to, but it doesn't tell us how the person got there or why they're there. It is a what, not a why. And so functional medicine is interested in the why, because by understanding the why, we can change what has gone on. And so we need to redefine the disease and have a new idea of how to look at it. To do this, we need different maps and different tools which help us to look at the same problems, but from a different point of view. We need to reinterpret the clinical information that we're presented and look at function and cause and systems versus the pathology, location, and disease names. And we have come to understand that optimal health is on a continuum to disease. And so many people are on the way to disease, but yet have avoided it because they have not had some sort of a trigger, or they're balancing their systems well enough to avoid it at this time. And so traditional medicine starts out looking at the signs and symptoms, as we mentioned. They go up to an organ system diagnosis, and then either the provider themselves with their advanced knowledge takes care of the problem, or they refer to a specialist who is an expert in that problem and who helps to care for that problem. The difficulty is that we've lost sight of the whole tree. And so in functional medicine, we start out with the same signs and symptoms, but we move down and look and see where the imbalances are, looking at seeing what caused it. And most of all, we look at the roots of the problem and try and fix those, because as we do, everything else seems to flourish and do better. So we have learned that one condition can be caused by many different imbalances. And so all of these different things cause obesity. On the other hand, one imbalance can cause many different conditions. And so we have learned that inflammation in the body can lead to all of these things and often will lead to multiple ones in the same person because the basis of the problem is inflammation. In fact, it is my belief that we all have weak links in our genetics. And so the inflammation that is throughout the whole body attacks our weak links wherever we have a tendency to have a problem, whether that be arthritis or depression or et cetera. And that's where the problem manifests itself, even though the cause of the problem is the same. And so these are the tools that we use to help us to navigate and to formulate the ideas. We use the functional medicine timeline, looking at the preconception of this patient, because what's happened to their mother and grandmother in utero has an effect on their progeny and the children that follow that. We look at the prenatal factors which affected this child or adult, and then we go through and we list all the different things on their timeline. Oftentimes an adult, when you notice that the problem began here, they start associating the things that occurred to them here that led to that problem showing itself. And so we use this as a tool to both explain to the patient where they're coming from, as well as to help us identify various causes. Then we have something called the functional medicine matrix, where we look at the 7 systems that get out of balance, and then we try and establish where the problems are. These are assimilation, which is bringing things into the body. And we do that through our skin, our respiratory tract, and most of all through our gastrointestinal tract, where we digest and absorb things. This is, as we mentioned, through a semi-permeable membrane. And when it's intact, it works beautifully to let through only the things that we need. But when it is not working, many other things can come through and cause problems. And when they do, they often cause problems with our immune system, which is meant to protect us. And if it's not working correctly, of course, we end up with various infections and diseases. But when it's working right, it is wonderful. Occasionally, it becomes hyperactive. Example would be the side effects of the COVID-19 infections, where the immune system fails to shut off and can cause tissue damage to our lungs and our heart. Likewise, other activators can happen, and so our immune system starts attacking our cells, and we call that autoimmune disease. We look at energy production, and not the rah-rah energy that we associate with activity, but the mitochondrial function. These are small organelles in every cell of our body that produce energy so that we can do what each cell is meant to do. And we used to think that that's all that they did, that they provided the energy for our cells. But we have learned that they are much more than that. In reality, what they also do is that they take and they have sensors to the environment, to the outside of our cells, and they will turn on and turn off various genes to help handle the outside environment. And that affects a lot. And so they're very important. When they don't function, many chronic diseases can happen. One such illness is Parkinson's disease. We have biotransformation and elimination, and our body is constantly making substances that are actually very toxic. And so if we didn't have a mechanism for getting rid of them, to excrete them into our intestines or in our urine, we would become toxic and it would be very punishing for us. And so we have very elaborate mechanisms to get rid of that, to deal with that. As well, we are putting things on our body and in our body that also need to be transformed to innocuous substances. For instance, a study has shown that the average woman puts over 100 chemicals on her body before she leaves the house in the morning. And all of these must be transformed in order to be healthy and to be safe. Transport is not usually a problem for pediatric patients, as our heart system and vessels are functioning fine. But as we age, they become harder, and certain areas of the body may not get all the circulation that they need. But in every person, we have a lymphatic system, which also carries waste products away from the cells so that they can be brought and biotransformed into things to be eliminated from our body. In fact, recently we discovered a new system called the glymphatic system, which is in our brain to bring the toxic substances that our brain makes as it goes through our day, thinking and doing everything that it does. And then it can eliminate them through the glymphatic system. When this system is not functioning properly, these can accumulate as irritants in the brain, such as the plaque that we've associated with Alzheimer's disease and dementia. And then we have communication. And for many years, we thought communication was really neuronal, only through the neurons in our body. But we now know that it happens with hormones, and we even have immune messengers which turn on various substances and things. One thing that was a surprise to me was to find out that our white cells that help to prevent infection and cancer and things of that nature have on their membrane receptors for our neurotransmitters. And so when our brain is feeling sad, our white cells sense that as well and may not function as well and leave us vulnerable to various diseases. And last but not least is the structural integrity. Those layers of cells that protect us from our outside environment, from our skin that helps to protect us against all the harmful things that we're exposed to. And then again to the single layer in our intestines and also our respiratory tree to help protect us against those things that we are ingesting in one way or another. It is important to notice, and that again, the integrity of this is very important, but it doesn't just stop there. Also, our musculoskeletal and structure are very important to help us, as are our tendons and the various tissues underneath our skin, our collagen, to help to protect us and keep everything flowing smoothly. In the center of this, we have our mental and emotional and spiritual aspects, which are really also important, because if they're out of balance, they also throw out of balance the other aspects of the matrix. To understand things better, we talked briefly about the ATMs in functional medicine, the antecedents, those things that precede the actual event, that set us up for the event. It's like if we were building a fire, the antecedent would be gathering the wood. By itself, it doesn't do anything, but it's there. Then we have to have a trigger, and that trigger could be lighting a match. Once we light the match, then a fire ensues, and that causes a problem. It's like we had a book that had 23 chapters, and each chapter represents a chromosome. On every chromosome are many different genes. Each one of them tells a story, a different thing that will be created. Well, if we had a book like that, and some of the stories were happy, some of them were sad, some of them were scary, at any one time we could choose which stories to read. And so we could choose our mood. Likewise, we can often control which genes are expressed by how we live our life. And so this is a picture, and over on the right is what we think of as DNA, that double helix that separates in order to form the enzymes and proteins that our body is capable of making. This is the readable DNA, but most of the DNA in our body is unreadable. It's wrapped around these proteins called histones that keep it tightly bound. And when it's in this state, it can't make proteins or enzymes or anything else. Now, the histones here are sensitive to the various environmental factors. There are messengers that happen from processes outside the cell and inside the cell, which come and tell the histones when to unwind and allow the DNA to come out to be read. We have learned that these factors are our epigenetics. They're not the DNA themselves, but it tells which genes are expressed. And we used to think that only our DNA was inheritable, but now we've come to learn that the process of which genes are turned on or turned off is also inheritable. And so situations that happened to your great-grandmother while she was carrying your grandmother could have an effect on you today by which genes are more readily expressed in your body. Now, this is a very busy slide, and it's meant not for you to look at the detail, but to get the gist that everything is interrelated. Here we have methylation cycles, and on the left side, you see all the different processes in our body, and this is a partial list, which need methylation in order to function well. And each of these are like wheels that are cogged. And so if one wheel isn't turning properly, the other wheels can't turn properly either. And so as we zoom in, we can look and see at two particular genes. This one is the MTHFR gene, which has to deal with taking the folic acid that's in our supplements and in some of our supplemented foods and converting it to the form that the body can use. If we're not getting this form, this does not turn, and so it can't help and contribute to the other parts of the reaction. And unfortunately, many of our foods have been stripped of their nutrients, and so they add back nutrients like folic acid, but it's in a form that can't be utilized. And so if this gene is not, if this enzyme is not working properly, then we're unable to deal with the folic acid, and it can accumulate, and our body is actually starving for the right kind of folic acid. Likewise, we have another gene called the COMT gene, and this one is essential for the creation and the breakdown of our neurotransmitters, but also some of our hormones like estrogen. And so if this gene is not functioning well, we can have depression, anxiety, ADHD, and things of that nature. And so it's become useful, and now we have ways of measuring these things so that we can tell which genes, and all of these are different enzymes, which of these enzymes in our body are functioning properly, and allow us to work with that. So functional medicine is the science of individuality, where we look at everything the patient's being exposed to. We look at their epigenetics, the nutrigenomics, how the foods interact and activate certain genes, and the pharmacogenomics. The pharmacogenomics is something I use all the time as I do one day of the behavioral health. And understanding how our body metabolizes various medications helps me to prescribe more accurately. If you don't have the gene to metabolize a medicine that we would commonly use, then that medicine will accumulate and cause more side effects. Likewise, if you don't have the gene to create certain things, such as if your COMT gene is not acting properly, then no matter how hard you stimulate it, you can't get it to happen. And so in functional medicine, really there are two questions to look for: cause and function. What does this person need to be rid of in order to function properly? And what is this need that they might have that we have not yet met to help them to function optimally? And so the things that we have to get rid of are toxins, things like elements, mercury and lead come to mind, synthetic substances that are in our environment, and other biologic substances that we may be exposed to. Various allergens and sensitivities as well can cause a problem to our system. The microbes that we've been exposed to, for instance, Lyme disease, various bacteria, the yeast, parasites, and viruses that we get, all can cause problems for us. Stress, which has been worsened over the last 18 months, and the chronic stress that we've been experiencing has a tremendous effect on our immune system, on our digestive system, on our circulatory system. So that becomes very urgent for us to deal with and to control. And of course, the standard American diet, the acronym is a SAD diet, because our diet is very, in general, very poorly constructed with a lot of things that can cause irritation, and without missing many of the healthy nutrients that we need to attain that optimal health. And so we need healthy foods, proteins, healthy fats, non-processed carbohydrates, and fiber to be healthy. We need various minerals, magnesium, we need certain vitamins, etc. We need clean light, water, and air in order to be our optimal health. We need to have movement and rhythm. And we need a meaning and purpose in life with community and love and connections to other people. So the functional medicine map is a journey. It's not a test or a treatment or supplement. It's a new way of thinking for the physician. We focus on the map, the matrix, where we've learned to look at various patterns and connections and trying to find that cause that leads to those clinical imbalance. And we focus on learning and teaching how to create the balance. I am fortunate that when we see a new functional medicine patient, that I have an hour and a half to 2 hours in order to digest all the information that they give me, to show them where the problem is, and to begin the teaching and learning that we need to create to get their engagement in order to create change, because that's the only time things are going to happen. There's a saying, one of the definitions of insanity is continuing to do the same thing over and over and expecting a different result. And so you might be asking yourself, what can I do? And what can you do? There are some basic steps that we've talked about that can help you to be healthy. Number one is to really make sure that you're attaining the proper amount of sleep. How do you tell? You awaken refreshed. We used to think it was just a pure number of hours, but that's only part of the picture, because we want not just a quantity of sleep, but we want the right quality of sleep. One of the things that affects both of those dramatically is having our electronics in our bedroom. And so I strongly recommend that your tablets and your phones and your computers be charged outside of the bedroom, in the kitchen perhaps, so that they're not a distraction to falling asleep properly. And even if you don't use them for that, they emit electromagnetic forces that can interfere with the proper brain waves to get the quality of sleep that you need. We need to reestablish a good quality circadian rhythm. Major problems and diseases started when we started getting lights inside, which disrupted going to bed an hour or two after the sunset every day and waking with the sunrise in the morning. And so when we do wake up, try to make it the same time every day and make sure we're getting plenty of sunlight in the morning, which helps to lessen the melatonin or turn off melatonin production. If you're interested, there are some great books which are listed in the handouts that are available at the Chautauqua Science Group website or my website. That will go over some of the books that are really useful for us. Likewise, food is essential. What we put in our body is critically important, and it needs to be real food, foods that your great-grandmother would recognize. Much of the foods that we have on our shelves today, they would not recognize as food. Ideally, we each want to get, as an adult, 1 cup of 5 different colors a day, not M&Ms and Skittles, but broccoli and cauliflower, green, orange, red, yellow peppers, tomatoes, strawberries, blueberries. Each one of these things has various phytonutrients and chemicals which help our cells to do what they need to do, the vitamins and things that our body needs in order to flourish. We should make vegetables our main course in the meal. We're filling half the plate. That way we'll be getting it. In those vegetables are also the fibers that we need to help nourish the healthy bacteria. That's what they eat for them to flourish and to grow. We want to limit or eliminate processed foods. These foods have very little nutritive value, don't usually have minerals, and actually may have toxins that interfere with healthy functions of our body. We want to have lean proteins as appetizers, mainly filling about 1/4 of our plate. We want to have healthy fats using olive, coconut, avocado, and sesame oils, and avoiding oils that can cause problems such as soy and canola oils. Soy is often contaminated with various chemicals which are not purified out in the making of the oil. If you're looking at if you would like to read more about this, 2 great books are listed also in your handout. Movement is critical. And if you would have asked me before I studied this issue, I would have figured out 2 of them very readily, but not the 4 that we see here. We all know about aerobic exercise, and high intensity interval training is an excellent way of attaining aerobic exercise because the benefits last for hours and hours after we stop the exercise. But getting 30 minutes, 5 days a week is really important of doing something for our health. Resistance and strength training is also very important. As we age, our muscles atrophy to some extent, but we have found that at any age, if we do resistance and strength training, not only can we regain our muscles, but we can actually make them grow. Vitally important is stretching, because all of the tendons and all of the connective tissue in our body need to be stretched. That helps to massage them, to help them to get rid of their byproducts and to be healthy and retain their flexibility. And as we age, we often lose our ability for balance. And so balance exercises are also very important to help us to be our healthiest and prevent falls, which is a major cause of senior morbidity. Stress reduction is critical. We need mindfulness, meditation, prayer. Here's a simple breathing exercise that you can learn to do, which is really easy to relieve that stress that we find. Regular exercise is also a good stress buster, but in these times that have been especially stressful, many people are needing therapy to help us to deal with it, and very effectively important to get rid of it. Our bodies are primed to deal with stress when it's acute, when we're confronted by a bear or something that's particularly scary. We need to be ready at a moment's notice to respond, to either run or fight or stay still. But in today's world, we're inundated with chronic stress, and this wears down our mechanism for responding and actually has an effect on our immune system, on our hormone system, and every aspect, our cardiovascular system and blood pressure. And so it's important for us to learn how to deal with the stressors and to minimize them when we can. And last but not least is love, community, connection, and a meaning and purpose in life, to find something that you really, really like to do and to be able to do it. I was taught a new concept last year called ikigai. It's a Japanese term for being ready and a reason for living. And it's the overlapping area of what we love to do, what the world needs, what we can get paid for, and what we're good at. And when we find our ikigai, it's not work, it's fun, it's play, we love it, and we don't tire of it. And so it's important for each of us to try and nourish these areas to find our ikigai so that we can enjoy ourselves and our life. And so the pillars of health are really important for us to hold up that roof of optimal health so that we can be our very best all the time. And so in summary, today we saw the different approach functional medicine has to patients to help them attain their optimal health and find the root cause of the chronic disease, the different tools and thinking involved, and how we do it. If you want more information, you could go to ifm.org. There's a free course that you can take which explains more about functional medicine. If you want to find a functional medicine practitioner near you, they have a database of people who are certified. If you want to find out more about me, you can go to my website. And these are in the summary that will be on the website of the Chautauqua Science Group, as well as my website. And so thank you for your time and attention. In a moment, we will be taking questions, but since I have some time, I'd like to go over a short case to explain and show you how we use this information. Here is Carl. He is a 6-year-old child who has ADHD, anxiety, stomach pain, and constipation. He was being treated with medicine for his ADHD, but that was worsening his anxiety. And he had a strong family history of ADHD. This is his timeline, and as we can see, he was a breech presentation, and I'm certainly not arguing with the medical necessity of doing breech deliveries, but there's a consequence when a baby does not come through the birth canal, that they don't pick up that flora that mother has there. And that flora particularly helps to mature their immune system. It helps to mature their GI system, and it helps to populate their GI intestines with bacteria which promote even more health. He was exposed to, in utero, to the painting of the house in the 3rd trimester, and mother had low iron throughout her pregnancy. While she was breastfeeding him at birth, which does help to replete some of the microbiome that he missed, but unfortunately she developed mastitis and had to stop feeding him from breast and instead had to give him formula. Well, the first antibiotic was at 4 months of age, and then he started getting recurrent ear infections multiple times, so that at age 3, he received tubes in his ears to help prevent the further infections, and that worked well to prevent them. But he went on to develop ADHD in 2016, and we realize now that really many years the child has ADHD, but it can't be diagnosed very readily until a child is somewhat older. We're finding that children that are born by breech have more infections, they have more ear infections, and also have various behavioral problems at a higher frequency than children that are born vaginally. We looked at a screening questionnaire, we call it the medical screening questionnaire, and he scored a 46, which is very significant. It's a review of systems that helps us quantitate all the symptoms, and as they get better and as we make our interventions, we can easily tell that the MSQ score drops and diminishes. Here's his timeline, and you can see the things that were out of balance for him. You can see the things we talked about with his antecedents. For children, we rarely find the trigger because they're unable to really tell us when they first started feeling ill, versus an adult can start actually oftentimes put a date on it where they can tell you, I was feeling well to here, and then all of a sudden I wasn't feeling well. We look at for him though, diet and stress were major components. He had a diet that was very heavy in dairy and wheat with somewhat less eggs. And he had a lot of stress due to his ADHD, being constantly reprimanded, as well as the anxiety that he put on himself. And so we ordered some lab tests. Some of them were standard lab tests like vitamin D, lead, magnesium levels, regular allergy tests, but others were more functional in nature, such as an MTHFR for him. And we looked at a functional stool test. Unlike traditional stool tests where we just look at the bacteria that cause disease like E. coli and Clostridia, this test looks at the constituents of the gastrointestinal microbiome, all those bacteria that make up our microbiome, to look at the balance of them, to see is there any imbalance. It looks for bad bacteria also, but we also look for digestive function, how the pancreas is helping us digest our foods. We look for intestinal permeability, and we also look for inflammation in the GI tract. And this gives us a tremendous amount of information about where we might need to proceed, since many, many illnesses that we've identified today, their origin is actually in the intestines with the microbiome and what's going on there. The results of the test, the allergy tests, were negative, but his vitamin D level showed that he was deficient in vitamin D. 80% of Americans are insufficient or deficient in vitamin D, partly because we're using sunscreen all the time. His lead test was normal, but his MTHFR showed that his enzyme was functioning at about 30% of normal capacity. That means all the folic acid that he was getting in his multivitamin every day, or in the foods that were supplemented with folate, was not being converted to the active form. And so it was building up and can cause problems in itself. And so what we did is we put him on a partial elimination diet. Mom felt that she could make substitutions for the dairy and the wheat in his diet, and she did that for a 4-week period of time. We arranged for him to see a therapist regarding his anxiety. We cleaned up his diet, and by that we got rid of a lot of the processed foods and the fast foods that he had been eating. A great resource for this is EWG, Environmental Work Group, which is a not-for-profit organization that evaluates the foods that we are exposed to. And every year they publish a list called the Dirty Dozen, which are 12 foods that are so contaminated by pesticides and chemicals that we're unable to clean them. And so if we want these foods, we, if possible, should eat them from organic sources because they're much lower or no residue of the various chemicals. They also publish a list, the Clean 15, which are 15 foods which you don't have to spend money buying organically because they're usually safe to buy. We added a few supplements to his regimen as well. That the supplements we put him on included some extra magnesium, which helps to soothe the nervous system, but also is very important because it helps with brain function. And even more than that, in combination with B6, it's some of the essential factors that are necessary for our cells making ATP. So a very, very useful element, which is very much lacking in the American diet due to the processing that it undergoes. We put them on omega-3 fats, which are very healthy for fats for brain. And 90% of us do not get enough omega-3s from our diet, which usually the best natural source are wild cold water fish, such as salmon and mackerel and sardines and herring. We put him on a good multivitamin with the right kind of folic acid in it, with methylated folic acid, so that he could absorb and utilize that. And then we followed him and saw him back. When we saw him back in 2 months, his teacher had reported that he was much better behaved. He was no longer as active. He was not acting out without tantrums. Even though his sleep wasn't initially a problem, he was sleeping better. His congestion was gone. And the stool test revealed 2 different things. It revealed that he had excessive yeast there, as well as an abnormal bacteria called Citrobacter, which can cause havoc and interfere with the healthy microbiome there. So we treated those things for him. In the mother, in the meantime, because his behavior had so improved, had taken him off of his medicine and had performed that elimination diet that we talked about. When she went to reintroduce the foods after a 4-week absence, she was doing 1 food at a time. And so she gave him milk and he got all stuffy and congested and coughing. And so she stopped that and let the symptoms clear. Then she decided to introduce the wheat back to him, the gluten. And so she gave him whole wheat toast for breakfast. And then she gave him a sandwich with whole wheat bread for lunch. But by 2 o'clock, he was starting to get irritable and fussy. By 4 o'clock, he was having meltdowns and he was having terrible nightmares. And these whole symptoms lasted for 24 hours before he was back to his calmer self. And so it was a really critical and illuminating idea for the mother to realize the effect of this particular type of food on his diet. And gluten is primarily found in wheat, but can be found in other things as well. This was a picture that he had drawn before while on the medicine. And for a 6-year-old, this is a very immature picture with no hands or feet, no hair, no ears, as he was drawing people here. This is the same child without the medicines just 2 months later, and you can see the detail of what he has done here and the tremendous difference in what he was able to do by cleaning it and helping his brain to function better. This was his handwriting before and after, and you can see how much straighter the writing is and everything else. And so at this point, I'm ready for any questions that you might have. I'll be glad to answer them and appreciate your time and attention in watching this with us. That is all that I have to say, and I certainly welcome any questions that you might have. I'm going to stop sharing.
Okay, we're live. So what we can do is now on our website, which is our website is Chautauqua Science, Chautauqua.com. Where is it? Here it is. It's Chautauqua Science, all one word, .com. And it's a 2-page prescription for what is proposed by Dr. Katz. I have a question on one of them. It says healthy fats, eliminate soy, canola oils, non-processed carbohydrates, and fiber. We've always been told that fiber is good. Can you explain why fiber is bad for us?
The fiber that we should be getting should be coming from our vegetables and our fruits, versus the fiber that we think like taking all bran. It is certainly is a fiber and can be beneficial, but we should be getting most of it from the vegetables, because that is the kind of food that the healthy bacteria in our GI tract utilize for their energy sources. And so rather than think of one type of fiber in a product, it is best to do it through our bodies, through our nutrition and what we put into our body that way.
Okay, thank you. Questions?
Yes, this sounds very similar to a holistic approach to medicine, and I wondered if you had looked into that and picked up any of their approaches, because holistic, as I understood it, and from my doctors, was treating the whole patient and not just the scratch or fracture or whatever it is you came in for. Thank you.
It's absolutely part of that spectrum of therapy. We indeed very much embrace the holistic approach. And there's another term which is also utilized, it's integrative medicine. And that too looks at the holistic approach. There are some differences between the integrative and the functional medicine approach, but both of them look at that whole person and try and restore the balance that we need.
I have a question. I'm real into fitness and exercise. And how do you feel about individuals who don't have diabetes using continuous glucose monitors to see how carbohydrates affect their body?
I think that the more information we have about our bodies and how we're processing things can be very, very beneficial. Sometimes it can be somewhat misleading, but I think overall it's the more information we have, even if you don't have diabetes, you can, by using these type of modalities, you can readily see the effect of a meal on your body, and that can be very useful to know which foods agree with you more or than not. So I'm very much in favor of that, as well as there are many things that can help us with our sleep, but sometimes they can actually be disruptive to sleep. But the more information we have, then we can learn how we can modify our lifestyle to be as healthy as we can make it.
Yes. Do you think functional medicine can assist certain types of cancer, or is that more preventative from getting cancer in the first place?
It can do both. If someone has cancer, I'm very much in favor of the traditional treatment. I'm not trying to say at all, but nonetheless, I have some very close friends who have had cancer and who were functional medicine physicians, and they prepared their body for the chemotherapy or radiation therapy or whatever was necessary to treat their cancer. And by doing so, they were able to have far fewer side effects from the treatment that was necessary to cure their cancer. Indeed, our immune system is responsible for preventing cancer, and the more we can to enhance the immune system function, the better we can do to help to prevent cancer. All of us are getting cancer cells all the time, but our immune system finds them and identifies them as not being normal, and then helps to eliminate them. And so the more we can support our immune system, the better we are for that.
Thank you. I have a wonderful primary care physician, and I have great health insurance. I'd been a government worker, and like the Congress, thank you for giving us a good health insurance. But my doctor, before COVID, if he could spend 15 minutes with me that was a lot. Now, I will say one of the blessings of the pandemic is when I could see him, he would spend 30, 40 minutes talking to me because he didn't have as many patients coming in. But there's no way that the doctors in Northern Virginia can spend an hour and a half or 2 hours talking to a patient and keep their business going.
That is part of the problem of modern medicine, is that we are paid for the number of people that we see or the procedures that we do. Unfortunately, that has been a major problem with functional medicine because insurance companies don't pay us to think. They pay us to see bodies and to move things. And so many of the functional medicine doctors are out of the system and don't accept insurance, which means that you have to pay for it and then submit it to your insurance. And so that is a real problem with delivering functional medicine to a large number of people who are really interested in figuring out what they can do, but it is an expensive proposition to be able to do that. More and more doctors are turning into the group medicine approach, and that's the Cleveland Clinic has a functional medicine institute, and that's what they've done. And they have found that their approach, where you still get that time with the doctor, but much of the education and the other aspects are done in a group setting, has been found to be very successful. And they have studied this rather extensively and found that at the end of the year, that the functional medicine approach compared to the traditional Cleveland Clinic approach was not only cost effective, but also the patient satisfaction was much higher, and the number of medications that they were on and their conditions had improved significantly above the traditional approach. So we know that this has been tested in a rigorous fashion and has been shown to be effective, but it is a drawback because it can be very costly to go see a functional medicine physician. On the other hand, Dr. Hyman is a prolific author, and he's written, I think, 20 books. Many of them are New York Times bestseller books that enable the person to do some of the basic things for functional medicine for themselves, if they're interested, on how to detoxify or how to improve their diet. And all these various things are really useful and can be done by anybody. And when you get to the point that you're getting stymied, then it might be time to see a functional medicine doctor, but it will be much less costly to do so. This year, the Medicare changed how they reimburse physicians. And for the first time, we actually are getting reimbursed for some of the time that we spend thinking about a patient before and after their visit. And so there was a big move by the Institute for Functional Medicine to encourage some of their doctors to get back into the system now that we can be paid for thinking. And I don't know how many have rejoined the medical system and will use your insurance for your billing. But there was certainly a very robust attendance at those webinars on how to do it and how to code for it properly to get reimbursed for your time and thinking.
I believe that Dr. Hyman has called Alzheimer's diabetes 3, and I was wondering what you thought about the role or the avoidance of sugar in the diet.
We have learned there's a neurologist who is a research neurologist at UCLA who has spent his lifetime researching Alzheimer's disease. And he's done many of the studies or participated for the drug companies to look and see which medicine would treat Alzheimer's. And he has come to the conclusion that it's not one problem. And so he has developed a program on how to actually, and has done, reversing Alzheimer's and dementia in patients, because he has found out that there's 5 or 6 major pathways for where a patient gets Alzheimer's and problems. And one of them is the abundance of sugar in our diet. Sugar stimulates insulin, and insulin is a very strong pro-inflammatory hormone. As well, of course, insulin causes our bodies to accumulate fat. And we used to think when I was in school that fat was relatively inert, but we've actually learned that it's metabolically very active. And so the fat produces chemicals that can cause significant irritation, inflammation in our bodies, and is responsible for many of the illnesses that we see in our world. And so, yes, there certainly is an element of excess sugar in our diet as one of the causes that can contribute to Alzheimer's disease.
How do you feel about immunizations?
I've been practicing medicine long enough that I have seen most of the pediatric diseases go away completely because we have great vaccines today. Things that I used to see 5 to 10 cases of severe meningitis that 1 or 2 of our children would die. 4 or 5 of them would have some permanent disabilities, and very few of them would come through completely unscathed. And through the process of vaccinations and immunizations, we have eliminated virtually all of these things. It's changed how we practice medicine. Whereas before, a febrile infant would come to the emergency room and they would immediately get a spinal tap because that was the most common cause of the problem for them. And today, if they've been vaccinated, that does not even happen because it is so rare an occurrence for us. So I strongly believe in vaccination. And one of the misunderstood things is, for instance, our current COVID vaccines. These were not just in development since January of 2020. These were in 8 years of development after SARS-CoV-1, where we were trying to figure out ways that we could combat what we would feel could be a pandemic type of disease. And so the research behind them is very well established, but there was just no need to have an active vaccine. And so they weren't brought to clinical use until we had a need for it. But the research is very strong. And in fact, I'm so excited because they're using now the research that we've used for COVID to take a person's tumor, for instance, and extract out the DNA and to create a vaccine using the COVID concept where they inject the DNA into the body that will stimulate our immune cells to make antibodies against our own cancer. So I'm very excited about the many adaptations of these processes and their future use for us.
What do you think about, most of us go to the doctor for annual checkups and they take blood. So now the blood comes back and everything is good but one thing. And all they do is say, okay, take this pill and you'll be okay. What do you do about that? Do you just listen or do you go into research yourself and find out what's better than that pill?
I think that we sort of have to take our health in our own hands. You know, for most of us as physicians, the extent of our nutrition education in medical school was somewhere between 0 to 3 or 4 hours. As part of my functional medicine training, I had countless hours of nutrition and to see the effects of the various foods and food groups on our body. And so, but this is something that, you know, we're just not exposed to in our traditional medical training. And so it becomes really a difficult situation. I very much favor trying to figure out what's going on and to see what else can be an influence for us to help us do better.
There appears to have been a major paradigm shift. Years ago, of course, people talked, especially in the medical professions, about fad diets and dangerous habits that are being utilized in order to lose weight and cure disease and so on and so forth. I think now certainly that has changed into an entire medical field, medical specialty. But certainly people have to recognize that it's not just patient, physician. There are an enormous number of medical people also involved, nurse practitioners, the dietitians, and so on down the line, which is why many of the academic centers around the country have actually set up rather large departments. And the question was, how do you spend more than 15 minutes? Well, actually, in places where I trained personally, you would spend 2 hours initially with a physician, metabolic specialist, going through all the aspects as you very adequately explained. And then it would be actually turned over to others in the field to actually set up a program which the patient could deal with, could accept. And it's working out quite well, and you're going to see more of this, I think, over a period of time.
I agree. I think that for a while I was working with Duke Integrative Medicine, which was a part of Duke that we had our own dietitians and acupuncturists and physical therapists, as well as psychologists. And we worked as a team for patients, because no one person can do it all or have all the expertise. And so I think that team approach is wonderful to have when it's available to us. But as a practicing physician in the field, now I don't have access to that dietitian. I can refer to them, but sometimes they're not covered by insurance or they're distance away. And so that can become a problem.
So you mentioned you look at microbiome as well, the gut microbiome. What do you do about discovery, let's say, of dysbiosis in that microbiome? How do you treat that?
Well, again, you have to figure out why is it occurring. The most common cause for that is that many of us are taking antibiotics. And as a pediatrician, I used to prescribe them all the time because we thought that they helped the cold. But what we discovered is the cold gets better in 5 days with or without an antibiotics. And so we have stopped using them so easily and readily. But every time we take something like that, it does help, and it can be essential to help cure the disease that's the problem, the ear infection or strep throat or things like that. But we've come to realize that there's a consequence for those actions, and that they do affect not just that area that you're focused on, but as they're adjusted, they affect the balance of bacteria. And so many of those antibiotics literally inhibit or kill off some of the healthy bacteria whose function is to inhibit the growth of the bad bacteria, as well as to nourish the lining of the intestines. And so restoring is to eliminating dysbiosis is not just providing healthy bacteria, but also providing the nutrients that they need to flourish and to grow and to provide the environment. Sometimes it requires getting rid of some of the bad bacteria, the overgrowth that can happen, and then replacing it. But also it's important to recognize that we have to repair the GI tract if there's been damage to it. One of the things that is little known is that glyphosate, what we call Roundup, which is sprayed commonly on many of our foods, such as soy and wheat, was actually patented as an antibiotic. And so as we ingest this on our food, that we're actually injuring some of that microbiome. Likewise, many of the artificial sweeteners that we use also can interfere with the healthy microbiome. And so even though they're not sugar, and that's a good thing, that they can interfere with the healthy bacteria that we have there. And so going back to using food as medicine to try and have that well-rounded diet that provides all the nutrients for the healthy bacteria to grow and thrive and to inhibit bad bacteria in our system.
Okay, thank you. That's about as much time as we have for questions. I want to announce that next week, Dr. Larry Rizzolo will talk about tissue replacement therapy for age-related macular degeneration. And for the last word, our president, Bob Hopper.
Well, I want to thank David Katz for reminding us of how much of our health is within our own hands. But I also imagine that many of you feel slightly guilty and regretful that you've known these things your whole lives. We know what we need to do to be more healthy, but they're hard to do. And fixing ourselves isn't easy, but if you come here and you help us, we can learn more things. Maybe we can get better. Maybe we can guide our grandchildren to be better. But I have a plan for you. If you want to help, make yourself better and make others better, we have a little box at the back where you can make a donation. Last week, I gave on behalf of the science group, the Science Circle, a $500 scholarship to a top science student at the local high school. I met with him. He's going to the Illinois Institute of Technology starting in the fall and going to become an architectural scientist. And he's a wonderful young man. And our ability to help, this is the 4th year we've helped a student at the Chautauqua Lake Central School. And helping one person sometime is what we can do. So let's help ourselves, let's help others. Visit our donation basket and have a good week.